guys, welcome back. Dr. Ilana Gelman here, naturopathic doctor. So I actually just got off the phone with a patient and it just inspired me to make this new video because I love talking to patients that are interested in prenatal health. She just got pregnant. We've been helping her with her infertility issues. And it's just so exciting. I love when my patients get pregnant because that's their goal, and so that just makes me happy. So I wanted to give you guys the 4 supplements that I always recommend all of my pregnant patients to always be on, okay? The first one that I always recommend is a prenatal vitamin. That's so basic. It's got your folic acid that helps to prevent neural tube defects. It's got your B vitamins that are depleted during pregnancy at times. It's got your basic vitamin A, vitamin C, D, E. I mean, it's got the whole gamut. So you need to be on a prenatal vitamin. The second one I always recommend is a good fish oil. And the fish oil specifically, you want it to be high in something called DHA. Fish oil is broken down to 2 different components, either DHA or EPA, and they have different actions in the body. DHA is really good for brain development, for eyesight. This is what the babies really need for proper brain health and brain development, whereas EPA is really good for inflammation. It's good to dampen inflammatory processes, and that's not what we necessarily need in pregnancy. So you want a fish oil high in DHA. Okay, the third supplement I always recommend is a probiotic. Really good for gut health, but what we find in some research studies is that taking a probiotic during pregnancy can help prevent atopy in your children. And atopy means your susceptibility to allergies, asthma, ear infections. These are all a group of conditions that fall under a condition called atopy. So we find that this can be prevented if mom starts taking probiotics during their prenatal or really conception and preconception and then their prenatal term. Okay, and then the 4th supplement is vitamin D, and I spoke about vitamin D in videos a number of months back, but the real important thing about vitamin D is that when mom starts breastfeeding, baby will start taking mom's vitamin D, and it starts depleting her vitamin D. So she needs to make sure that her stores and her reserves are high enough that when she starts breastfeeding, having baby, that baby has adequate amounts and mom has adequate amounts. Now, I always recommend getting vitamin D levels checked, but to this day, I still have not ran one vitamin D panel, blood work, on a patient who has not been in the optimal range unless they're supplementing. Even people supplementing are still not reaching the optimal range. So I just always recommend my pregnant patients just go ahead and start taking like 2,000 IUs of vitamin D. It's not going to be harmful, but I always like to see what their vitamin D levels are because they may even need more, may even need less. Okay, so that wraps it up, the 4 of them. Prenatal vitamin, we talked about fish oil, high in DHA, we talked about probiotics, and we talked about vitamin D. Those are like my favorite 4 definite supplements for every pregnant lady out there. All right, well, I got to get going. Got my last couple patients of the day, and then I'm off tonight. All right, have a great week, and I really look forward to answering some of your questions. I have a list. I just keep on getting wrapped up and inspired to do other topics, but I have my list, and I'm really going to get to your questions, and I'm really excited to start answering some of them. All right, you guys, have a great week. Talk to you soon. Bye-bye.